Okay, so if things, aren't to that extreme, what is it that you at the health center are able to do for me? Are you able to write a prescription, give me a prescription? What exactly?
We are. Are you speaking of the nurses and the doctors?
The nurses
will
doctors.
Evaluate you, do a strep test if you need if we think you have a strep throat. And there are things that the nurses are actually allowed to give prescriptions for. If you test positive for the strep test, we're allowed to start you on an antibiotic. If you have an eye infection, we're allowed to start you on some antibiotic eye drops. So it depends on what you have. But there are some things that, yes, we are able to treat. But the majority of things that you would need a prescription for, you would need to see a physician.
So what were to happen if I were to get sick on a weekend? Obviously, I don't believe that the health center is open on weekends.
No, it is not. It has not been for many years. What students typically do, if it's an emergency, is to go to an emergency room because they are open 24 hours a day, 7 days a week. However, this year, because we have this new practice of physicians, they do have a Saturday morning walk-in clinic from 9 a.m. to 1 p.m. And so if we see students on Friday who maybe aren't really ill enough to have to go for a visit to the doctor, but we're not sure that they're going to make it through the weekend without needing a doctor's care, we will make arrangements and for them to go to the walk-in clinic. Other than that, they need to use a local emergency room.
I know that there is a little, what I consider a goodie bar found in the health center.
The cold center.
The cold center down at the health center. So where can I find this little center? What are your procedures when it comes to that?
Well, the cold center is actually in our health education room, and it's just a long counter with some over-the-counter cold medicines, ibuprofen, Tylenol, decongestant, throat lozenges, and also some Band-Aids and antibiotic ointment. And we also have some paper thermometers and instructions on how to use those. And students are welcome to come in and use that cold center anytime the health center is open. And in a drawer in that room are condoms. And students are also welcome to come and take those condoms whenever they would like. As long as we're open, 7:30 to 3:30, we welcome students coming in and using the cold center, and they do use it quite a bit.
So how often do you feel maybe students come in to get, those items?
How often, how many times a day? Probably, I would say 6 or 8 students at least a day use that cold center.
Great. Now, I think that maybe what people would maybe be more embarrassed about coming to you guys and getting are the condoms, just maybe to relax anyone who might need to tap into that resource. Like how often maybe do you see people accessing that?
We don't actually see people accessing it because it's a drawer. It's the first drawer on the counter near the door. And once students know where it is, the problem is that the drawer will be empty and we won't know it because we don't even know that they've gone in and so we try to check that drawer a few times a day, especially toward the end of the week when that seems to be the time when it gets emptied the most often. It's very often that fraternity members who are just joining, that's one of the things they're required to do, and so they get to know where they are, and then they share that, I'm sure, with their friends. So we don't know. We really don't know how often they come or how many they take because it's just a matter of just keeping the drawer filled.
It's like a SWAT mission basically for students, just
Yes.
keeping it quiet from parents and everyone else. So although you down at the health center are very nice, very helpful, how can college students maybe avoid a constant visit to you guys? How can we stay healthy? What are the basic tips?
The very basic tips are wash your hands frequently and do everything you can to boost your immune system, and that means getting enough rest and eating well and having some recreation and getting some exercise, but anything you can do to boost your immune system, especially at this time of year. But those are really the two big things.
Also, would you maybe even, I know that whenever I was coming to college, my family suggested a multivitamin. Does that help at all in your experiences, just to boost the immune system?
I don't think it's a bad idea, but I've never heard that it's absolutely necessary, but it's certainly a good idea.
So definitely around cold and flu season.
Especially at this time of year, yes.
Wash your hands.
Wash your hands.
Before, after eating, bathroom.
Touching common surfaces, yes.
All right, well, that's basically all I have for you, unless you have any other closing comments that you'd like to give.
Can't think of anything you've asked me many thorough questions, so I can't think of anything.
All right, well, thank you very much. And for more information on the Health Center, you can stop by their website at www.westminster.edu/student/health center. Thank you very much.
Thank you.